Ginger is something that might just help you with nausea. That's right. For some people, ginger helps a lot. Now, of course, nausea is something that is pretty individual. What might help you is probably going to be different than what helps other people. But keep in mind that ginger may help do the trick in terms of nausea. Some other foods that we'll talk about that may help or hurt when it comes to nausea. Ginger ale, right, very similar to sort of the ginger concept. That's actually something I used when I was a child to sort of help settle my stomach. Also, chamomile tea is something that's been mentioned as something that may help as well. I can tell you as a family doctor, one thing that I'm often recommending to my patients when their stomach is upset or they feel nauseous is a bland diet. Crackers, bread, something very bland that's not going to irritate your stomach. Something bland and kind of just to keep you steady, I think can be very helpful. But remember, when it comes to nausea, let's take a step back. Nausea can be caused by a number of different things. And ultimately, probably the best way to treat nausea is to fix the underlying thing that's causing it. If it's acid reflux, sort of fixing that. But remember, there's many causes of nausea that can't be fixed. Pregnancy can cause nausea. Chemotherapy medications for cancer treatments, other medications that you must take. Some might cause nausea. There are plenty of other things. If you have a gastrointestinal bug or if you're sick, and so many other things can do it. So I just say this to say, if you're able to treat or fix the underlying cause, great, but many times we can't. So other sort of foods and drinks and things that I sort of recommend and don't, try to avoid liquids that will irritate your stomach. First of all, I should say that staying hydrated is super important, so we want you to stay hydrated. But caffeinated beverages may irritate your stomach, may not be the best thing. Again, everybody's individual, but keep that in mind. I would also say avoiding fatty foods could be very helpful. I talked to you about the bland diet. I think that's very, very helpful. And then, for some people, strong odors when we're nauseous can be so troubling, can actually make the nausea worse. So you want to think about that as well. Now, remember, we do have prescription medications for nausea, okay? So if it's something that you're not able to overcome on your own, call your doctor and see if there's something else that can be done for your nausea, namely a prescription medication or something else. And in terms of medications, let me talk about this for a second, because some medications, some supplements can cause nausea. It can be helpful to try to figure out which is doing it if this is the case. Don't ever stop or start anything without your doctor's advice in terms of medications and supplements, okay? But it's something to talk with your doctor about, because some medications you might do better with from a nausea standpoint if you take it with food, if you're allowed to, or what have you. So those are things to kind of keep in mind. Is it a medication that you're on that's doing it? What are the options with that? You'll want to talk with your doctor, okay? These are just a few ideas of things that might help your nausea. I'm really curious. I'd like to know, what do you do for nausea? Like when you are feeling really sick to your stomach. There's also, by the way, I should say things like, acid reflux medications or stomach upset medications over the counter. Some of these things actually might help with some of your nausea symptoms too. But let me know, write in the comments, what do you do when you are nauseous? I want you to write in the comments, because sometimes what you write actually helps other people. And what's worked for you. Once again, check with your doctor before you do anything. Check with your doctor if things don't get better or go away. Check with your doctor before you add meds or change meds, okay? But I'm Dr. Jen Caudle, practicing family physician, on-air health expert, and video creator. I hope this was helpful. Please share this video with other people. Let me know what you think in the comments. On Facebook, please like and follow my page. For those of you who send stars, I appreciate you, and thank you in advance. On YouTube, please subscribe to my channel. Click the little bell for updates. Also, go to my website, drjencaudle.com, to sign up for my free health newsletter. Guys, I'm Dr. Jen. I'll see you soon.